everyone, this is Rachel Yang, and I am the founder host of Project We Inspire. Today we are interviewing triple board certified Dr. Mina Ha from Davis, California. I don't know about you guys, but it is super hot here. We're like at 100 degrees plus sometimes, and so hopefully you guys are like in a much cooler weather than we are. So if you guys are still new to Project We Inspire or wondering what our mission here is all about, we are here to highlight and interview unique individuals who overcame obstacles and challenges in order for them to accomplish their goals, dreams, and passions. And we are super lucky today to have our special guest, Dr. Ha. And she is a good friend of mine and somebody that I've worked with for a few years, right, at Heritage Oaks Hospital. So I'm so glad that she was able to take time from her busy life and schedule her private practice to be here to talk a little bit about how she became a psychiatrist, successful psychiatrist today. So, but I want to say I'm super proud of her and I'm so glad that she's here. Welcome, Dr. Ha.
Thank you. I'm really excited to be here.
So just before we start, a small disclaimer, for confidentiality purposes and just in case if you should need any emergency services or if you should feel suicidal, homicidal, or anything that is not safe for you at this moment, please feel free to call 911, talk to your primary care provider or practitioner. We'll also provide some resources at the end, but you can also call 1-800-SUICIDE, 911, contact NAMI. And if you go to Dr. Ha's synapseassociation.com, she also has resources under forms and resources where you can also contact different organizations and places in case you should need support or help, right?
Definitely.
Okay. All right, so we're gonna start kind of from the beginning of Dr. Ha's life because I'm kind of curious myself. So, I'm just curious, where were you born and how many siblings do you have and where did you mainly grow up at?
So yeah, I know when I told you this, you were surprised. You thought I was born somewhere else.
Yeah.
I was actually born in Seoul, South Korea, and immigrated here with my family when I was about a year old. And I have one twin brother who I'm very close with. And we grew up actually mostly in the Midwest. So I've actually, I grew up mostly in Ohio. We did grow up in Ohio. Yeah. So I was there from the ages of 5 to before I went to college. So yeah. So it's very different, because there wasn't a lot of Asian people when we were growing up. So that was a different experience.
Yeah.
Yeah.
Wow, I didn't know you were born in Ohio.
I wasn't born in Ohio.
Oh, yeah.
I was born in Seoul.
Seoul,
yeah,
sorry. But you grew up in Ohio.
Yeah.
Very different from California.
Very different, yeah.
Because there's hardly any people out there, like you said.
No, there were, no.
All right, so moving along to what inspired you to become a psychiatrist and for you to select your colleges and becoming interested in psychiatry?
Yeah, so I didn't know I was going to go in psychiatry. I was always interested in the brain. Actually, I did like the project of the brain when I was in first grade, like a poster about it. So I was always interested in the brain, and I think, I don't know, just I found psychiatric illnesses interesting from what little I understood about them growing up. But I knew I wanted to be a doctor. Initially, I actually wanted to be a lawyer, but then I shadowed one that was so boring I fell asleep. He was just sitting at his desk, and then we had lunch. That was the most exciting thing. And then I decided to become a doctor because I thought, I was always interested in how the body works, and so I went to medical school. And then during medical school, during your third year, you do different rotations are required. So you're required, everyone. So all medical students are required to do surgery, OBGYN, psychiatry. Internal medicine, I think pediatrics, and maybe family practice. So it was my required rotation. And I actually didn't know what I wanted to do. I almost went into emergency medicine. And I had my application all set up. I just had to press send.
Yeah.
And I was kind of thinking about, well, if I'm on my deathbed, what am I going to think about, like, my career? And I really liked emergency medicine. It was a lot of fun. because you're working everything up as they come in.
Mhm.
But I kind of felt like I wouldn't get to develop relationships with patients, like long-standing relationships with patients, and I would miss out on that. And so, and I also did some research in emergency medicine, and I talked to someone I did research with, and she said not to go into it. Like, if you want to have a family, like, it's not a good lifestyle, and she spent a lot of nights and weekends away. And so I was just thinking about my rotations. I really like psychiatry. So I was thinking about psychiatry. Another one I was thinking was maybe like hematology oncology and working with cancer patients, but then I thought that would be too depressing. And so I was worried about going to psychiatry because I felt like, there's still a stigma attached to mental illness, and then by, proxy, I think psychiatrist. And but I was like, I'll just do it. If I don't like it, I can always switch out and do internal medicine and do hemo. And then I did my first year of residency, and I loved it. Like, I absolutely loved it. Yeah, because I kind of thought about my rotation, and I just really enjoyed working with the patients. I thought the illnesses were fascinating. I feel like you really make a difference in people's lives.
Yes.
I really enjoyed the study materials too. It's much more interesting than like learning about the heart or the gastrointestinal tract. Like, that's kind of boring to me. So that's one of the reasons, and I loved it. I've loved it since then. Like, it's definitely a good match for me.
That's great.
Yeah,
I definitely
really
see you as a psychiatrist more than a lawyer or
ER doctor.
So I'm really glad you chose this.
Yeah, I was like worried about choosing it. I was worried that my family wouldn't like it, But my dad was actually happy that I didn't go to the ER because he thought that would be a very stressful lifestyle.
Yeah.
So he was actually very happy with it. I was surprised. I was kind of scared to tell my dad, but he was fine with it. Yeah.
That's good to know. Yeah, I don't see you in the ER either. I think I see you more working with people one-on-one and this connection that you have with people that I've seen. So I like that a lot better.
Yeah.
Also, you mentioned in some of the areas of this research, you had a study of genetic risk factors for suicide in pediatric bipolar population, as well as depression in the autism spectrum population. How are these two populations significant and inspiring to you as a psychiatrist?
I think I was really interested in just depression in general, and so that's like the common theme there. And I was interested in studying some of the genetic risk factors for it. There was a paper that came out a while ago by this guy named Caspi, and it talked about how, if you have a certain gene, then you're more likely to have thoughts of suicide. And so I thought that was really interesting. So that's why I actually looked at that for the bipolar population, and then looked at depression in the autism population. I mean, they're both very different. And one of the things I noticed, at least in psychiatry for myself, is even like I would have initial biases about like, this is the population I want to work with, or I don't really want to work with this population. But any population I thought I didn't want to work with, as soon as I started working with them, I actually liked working with them. So do you have the same thing?
Yes, I did. I totally had the same thing.
Yeah, isn't that weird?
Yeah, it's totally weird.
What is that about?
I don't know. I think it's just maybe just a calling. Like I think it's just natural. Like if you don't like it, it's just gonna connect you with it more.
Oh, really?
I don't know.
It was like for me, like I didn't really understand them. And so once I started working with them, then I understood. You know what I mean? And also I think it was a fear of not, like I think I had a fear of not being able to connect with them. Maybe that was it.
Yeah.
But then when you start working with them, you realize that you can connect with them. Just like maybe, different ways for different, people. So,
No, that makes sense.
yeah.
Sometimes when you don't really understand a population or know, you might not feel like you're able to, reach out to them or
Or I had like with like substance use, I think I had my own internal biases before I started working with them.
Yeah.
And
you worked
also
really great with.
Oh, thank you. Yeah, but I think it wasn't something that initially was there.
Yeah.
So but like all the I remember being scared of schizophrenia, and then I started working with that, loved it.
Yeah.
Same with substance use, same with autism, but it's really
I was gonna say, wait, those are the ones you're really, really good at. You're working with. I mean,
Oh, thank you.
Thank you for sharing that. So also, your work and research has been published in peer-reviewed journals in APA. Please share with us the work that you've published, and you also presented at APA. And so there's two APAs for those who don't know. and I looked at the wrong one, or the other one, the American Psychological Association, which is what the APA format that you usually use for writing and stuff like that. But the one that we're referring to is the American Psychiatric Association.
Yes.
So, Dr. R, can you please share with us some of the work and presentation that you've had?
Yeah. So I did present, so one of the studies was with the children of parents who have bipolar illness, and we were able to find a correlation between one gene and having higher rates of suicidal ideation. So that was one poster I presented. I think that was like years and years and years ago.
Yeah.
And then some of the most recent actually poster presentation was just last year, or this year. It was a virtual meeting, and it was actually with one of my medical students that when I was working at California North State. And it was just a case presentation on a patient who had failed lots of different treatments, including ECT and regular TMS, and then responded to deep TMS. So that was my most recent presentation. Some of the papers that I don't have a lot of publications, but I have a couple of review papers in one bipolar disorder treatment that's from years ago, and then one on how to assess ADHD in primary care and treat that in primary care settings. I'm trying to think of what other. I wrote like a book chapter on like environmental risk factors for autism. What else? But yeah,
Well,
so
that's a
like,
lot.
That's
a lot of work.
So,
Wow.
yeah.
Well, definitely if anybody's interested, feel free to look at it. I'm sure they're still out there in the peer-reviewed journals.
Yes.
And for those of you who are students right now and are interested in looking at Dr. Ha's work, I'm sure you can go to the library and look it up, and it will be in there. So I'm gonna go look, But thank you for sharing that. So also, it says here, or you shared with your bio that you were attending supervisor with Stanford, and you also with the Stanford psychiatry residents and medical students at Palo Alto VA and the Children's Health Council. Okay, it's a mouthful. And then you also headed the ADHD clinic. You also teach at UC Davis as well. So how have these roles helped you with your career today?
I'm so
It's
sorry
okay.
about
No.
that. Let me I should turn this off, huh?
Yeah.
How do I do
No
that?
worries, it happens.
How do you turn this off? I don't even know how to use my phone. Maybe I should just put it somewhere else. Or just, okay. Sorry. I'm like so not tech savvy. I switched from an iPhone to a Samsung.
Oh,
And now I don't know how to use it.
well, I would I'll be the same way. I'm an iPhone person, and if somebody gave me a Samsung or Android, I'd be like, I don't know, no
so
worries.
I apologize.
No.
So your question was about teaching?
Yeah,
So-
teaching and then being a supervisor with Stanford at the
Children's Health Council and Palo Alto VA. And the question is just like how.
Yeah, well, how have these roles helped you with your career, and how?
Oh, I see.
What did you learn from them? What was your experience like?
I think it was really. I mean, I like teaching a lot. I actually really find it enjoyable. I think it's inspiring because sometimes you can kind of take what you do for granted, and then when you see it through like younger eyes, sort of like fresh. It just makes you appreciate, how lucky we are and fortunate we are to do the work that we do, working with patients on such an intimate level and helping them with, things that are very, sometimes scary or hard for them to even talk about. So I think it keeps that really front and center. So I recognize how special that, the work that we do is, and so I really enjoy that. They also keep me on my toes.
Yeah, I was gonna say.
How are
the students like?
Oh, the Stanford ones were like top notch.
Oh wow.
Like they were just like top notch. Yeah, that was like pretty impressive. Yeah.
Wow. Because I can only imagine.
It depends on where you. I mean, there's good students everywhere, but some of them were like they were pretty top notch. Yeah, like the medical student, the Stanford medical student was like
Yeah, that's what I was fascinated by when I read your bio, because I was just thinking, I would love to teach one day too, and then I was thinking,
You do good at it.
I don't know if I'll be able to teach us but I was just thinking, wow, with your experience.
I mean, the only reason is because I worked, because I did my training there, so then you have connections. So that's basically why, know. But yeah, the students were great. I think the thing it taught me, one of the things it taught me is like, I think I had a tendency to think that people learn the same way I learned, but everyone learns a different way.
Yes.
So I think that was something that helps me as a teacher, is to kind of not make those assumptions and try to, meet them where they are in terms of their learning. And you always have like students that are like super bright, and those are and enthusiastic about learning. Those are like the most fun to work with.
Yeah.
But then you'll have like, people who are kind of in the middle, and then you'll have like the ones that are like not interested.
Yeah.
And those are like the challenging ones. Yeah. So those were kind of hard, there were lessons to learn there too. So.
Yeah, definitely. Yeah, I remember those college days. Some classes were not interesting and some were wonderful.
Right.
For sure. Also here, Dr. Hall, you were a speaker at Stanford Autism Working Group for the presentation of depression and anxiety and autism. Can you please share some of the key points that you spoke about in your speech for our audience today? What was important, with your presentation?
Yeah, so that was basically based on the research I did with Dr. Hallmeyer. He is one of my mentors, excellent physician and scientist. And so we were looking at depression in adolescents who had, they actually had high functioning autism, so what you would call that, what they used to call Asperger's, I guess, back in the day. And one of the things that we found in our research was that the ones that actually had higher IQ were more likely to get depressed, which is really interesting.
Oh.
And there's lots of hypotheses of why that is. Is it like they're better able to be in tune with their emotions? They're better able to communicate them? Is it because they're more likely to be mainstreamed in society, and so they have more expectations on them? So we don't really know, but that is something that we found. And it seems like it's been published now, so I've seen other papers that seem to find that same correlation.
Oh, wow. That's very interesting. Higher IQ with
more likely, to be depressed. The ones, at least in our study,
Wow, that's very interesting. So overall, you've had great experiences teaching, and I want to talk a little bit about your clinical lab experience. And you also shared that you were, a site principal investigator, PI, of an international clinical trial at the Mind Institute. So if you could please share with our audience and with us what a site principal investigator is, and what is like an international clinical trial, and where is the Mind Institute at? Sure. So so we can kind of know where it's at, because not everybody, including myself, know what that is all about.
Yeah, the Mind Institute is an institute that it's actually part of UC Davis Medical School, and it's here in Sacramento, and it is dedicated to studying basically two developmental illnesses in childhood that are psychiatric or neurological. So mostly autism is a strong thing that they study, as well as ADHD. So I would say those are the two main diagnoses they focus on. So a clinical trial is a trial that you're doing and with patients, and it's like, you're following them over time with some sort of intervention. And this was an international one, and it was, so there was not a lot of countries involved, but I think the US was involved. I think Canada, there might have been another country, so technically it's international. And then they have different sites in each country, and then that are involved in the trial, and they kind of collect all that data, so you have like more numbers to make a stronger study. And so one of the trials was going on at the Mind, and I was the principal investigator of that site at the Mind Clinic at that time. But I didn't work on the trial that long, honestly, just to let you know. So, but that's what a clinical trial is, and I was always interested in clinical trials. Because I kind of felt like, at least in psychiatry, there's so many things that we don't know about. But it was interesting to actually be involved with one because you kind of see how real life is really messy and it's really hard to do. Yeah, or even in my other, research I did as a postdoc, it's like it's just not that clean as you think it is.
Yeah, I was gonna say
it's really messy.
Yeah, I was gonna
It's
say
hard.
life is kind of messy, and then I imagine studying people in general.
Right, because it's people, right?
It's
so
people's
there's so
lives.
many, variables.
So many factors.
Right.
Many different life scenarios and challenges that we all face, and so I can only imagine how different a life will look like under a clinical trial.
Right.
And then compare that to so many other people's lives.
Right.
Especially if you're studying depression, autism, ADHD.
Right. Yeah, no, definitely. So it's not as clean cut. It kind of made me realize, when you read studies. I mean, I definitely still believe in evidence-based medicine, but you kind of take everything, you have a better understanding how they, the data maybe not be as clean as it looks like.
Yeah. No, that's good to know. That's really good to know. For those that haven't been involved in a clinical trial, they might go in thinking that everything's very simple, clear cut, but it might be more complicated,
Right, a little bit more nuanced.
Yeah.
Or you can see why one study would say, oh, there is an effect, and another study would say, no, there isn't an effect,
Absolutely. Right, thank you for that. And then now that you have your own private practice, congratulations.
Thank you.
I know that you had mentioned about having your own private practice several years ago when we were at Boston.
Did I?
Yes, you did. Yes, you did.
Did I really?
You did. Yep. You said, I hope one day I can have my own private practice. And yeah, you did. And I said I was thinking about the same thing, but I just thought about it and I go, wow, she talked about this. What, 7 years ago? Like 6, 7 years ago. A long time ago. So it's been in the works. So I want to say,
my mind.
So I want to say, I'm very proud of you and very happy that you have founded Synapse Association here in Davis, California. And how long have you been in practice now?
I was thinking about it. Not that long, maybe 2, 3 years, 2 years.
Yeah, I was going to say, it's fairly new.
It's very new.
Yeah, it's very new. And before we dive into some of the services that Dr. Ha offers here, I wanted to just mention some of the leadership roles and things you've done in the past. And I'm very impressed by them, so I just want to share them. But you were Chief of Staff, Quality Management Director, and Dual Diagnosis Unit Director at Heritage Hospital, where we met. You are the Medical Director of Adult Services for Sutter Center for Psychiatry here in Sacramento. You are a psychiatric clerkship and associate professor at California North State School of Medicine. Plus, you continue to teach at UC Davis School of Medicine, and you're a co-instructor for the adolescent course for child psychiatry fellows, right? All right, so those are many roles and hats that Dr. Ha does for our community. So I am always impressed and I admire Dr. Ha. So with all that, what do you offer here at Synapse Association? Because I looked over her website, but there are some really neat new things that you're offering here. So tell us a little bit about it.
Sure. I mean, I think that one of the things that one of many reasons why I love psychiatry is that it's a really good time to be in psychiatry right now because things are really kind of speeding up in terms of treatments. Like we have so much more to offer than we did even 10 or 20 years ago or 30 years ago. So we're more able to effectively treat illnesses and help our patients. So with my research background and wanting to help patients, I have the ability to, if I'm interested in type of therapy that's novel and new, to incorporate it into my practice. So I do try to do those things. So some of the newer therapies like deep TMS, which is cranial magnetic stimulation, I offer in my clinic. Spravato, which is esketamine spray that just got FDA approved for depression, is offered in my clinic. I also, boarded addiction medicine, so we do Suboxone inductions and treatments here for opiate use disorders. I provide Vivitrol injections for alcohol use disorders. So that's like one of the, I mean, there are a lot of things I don't like about private practice, but one of the fun things is like, oh, if I have an idea, if I want to do it, and I have the energy and the resources to implement it, you can implement it.
Mhm.
So those are some of the unique things I offer here. I obviously do, general psychiatric care, so I'll do psychiatric evaluations and treatments. We do like Connors testing, not testing, but Connors, we'll use Connors to screen and diagnose ADHD along with, a psychiatric evaluation. And I do have a very small practice of therapy patients for cognitive behavioral therapy for children, adolescents, and for adults. But I don't have a very big practice of that just because I want to be able to offer these other services because I know that there are not that many psychiatrists or physicians that offer those services, and they're in more demand versus therapy.
Yeah, I was going to say, Dr. Ha, that I looked over all the services that you provided on your website, and there's several clinicians and therapy, in general in this area, but like you said, it was the cranial, what is it?
TMS. The deep TMS.
Yeah, the deep TMS is new. That's not offered in this area. And then I think there was some. There's the other ones that you had mentioned earlier that they don't have in this area. So that's very unique to your practice. Right?
Yeah. I think it's getting more. Like I feel like TMS is definitely like expanding, and more practices are getting it. I think Spravato. I think there isn't really any Spravato in this area.
Yeah.
So, but it's still something that I think people don't know about. So like spreading the word, and also one of those services that is not readily available for patients too. So
you said Spravato.
Spravato. Yeah, which is esketamine.
Okay. What can you tell us a little bit about that? I'm curious. Like what's the treatment? What does the treatment look like?
Spravato is just a nasal spray actually, and the patient has to come here, and depending on the doses, they have like 2 cartridges or 3 cartridges of the nasal spray. One of the things that can affect is blood pressure, so we just have to make sure that blood pressure is okay, and we monitor that. And then they have to stay in the office for 2 hours. They do need a ride home though, because they're not safe to drive home. And then after they get a good night's sleep, then they can, drive or do normal activities. But I had this is somebody I probably should write up. So I had a patient who had failed. She did write a testimonial too for, but she had failed ECT. I actually did deep TMS on her too. Lots of different medications, and this is the only thing that's worked for her. So before she couldn't even get out of bed, and now she can
Is this for clients with depression? Okay.
Yeah, it's like treatment-resistant depression. And then another good thing about the Spravato is it kicks in right away. So even in that session, so you don't have to wait. You know what I mean? It kicks in right even during that session. They'll feel better. So that's kind of nice.
Yeah, I recall working at the hospital with you that the medications or antidepressants would take anywhere from 7 to 10 days, or it could take weeks for to get into your list and get And so for this to I can't say the word yet, but for it to work the nasal spray rate, for it to work right away, that's a really good turnaround.
Yeah, it's nice, especially if someone's in crisis.
Yes.
And again, it seems to be, for some people, they failed so many different treatments, so it's nice to have another tool in the toolbox that works differently.
Definitely. Just another question before we go to your awards and honors and to what you're doing with the local APA chapter. What kind of clients and patients come to your clinic, or what? I know we can't disclose all the diagnoses, right? But who usually seeks your services? What kind of patients like that?
Yeah, I would say the majority of my patients are actually UCT students, believe it or not, just because I'm in the area. So they're usually, a lot of undergraduates and a lot of graduate students. They tend to be pretty high functioning patients who come here because it's an outpatient practice. And I do see, some children and adolescents. Mostly mood disorders, anxiety, ADHD, some substance. Those are probably the main diagnoses that I work with in my clinic.
Oh, okay.
Yeah.
That's really good to know. I'm
A
glad
lot
that.
of women, I would say.
Yeah.
And I think because I'm Asian, I get a lot of Asian women too.
Yeah, I was gonna say, I wonder how the gender percentages and then
Yeah, definitely more women than men. I do wonder about that.
Yeah.
Because I bet you there's more women than men that seek mental health care, but I wonder if there's even more for me because I'm female.
Yeah.
Probably, right?
That'll be a good study. That'll be something to look into.
I do get a lot of Asian women. I don't know if it's just because there's a lot of Asian women in the Davis area. Yeah.
Thank you for sharing that. Yeah, I was gonna say,
Oh,
we
yeah, I
didn't
didn't
really
realize
look
that's how
figure
they're
out.
Yeah. Is that
So,
okay,
sorry about that.
Yeah, sorry.
Everyone. So we're gonna try to. We were sitting up earlier.
I got to relax. I was like,
So.
we have that effect.
So with your awards and honors, you've shared that you've been honored as a distinguished fellow status in the American Psychiatric Association and the American Society of Addiction Medicine (ASAM). What led to these great recognitions and honors?
So I think for the APA, the American Psychiatric Association, I think a colleague nominated me. I actually don't know who that colleague was, and this is when I was working at UC Davis. Someone had nominated me, and then they just told me, someone nominated you, can you submit your CV? And I submitted my CV, and then they gave me that.
And CV stands for?
Curriculum vitae.
Vitae? Yeah. Okay. Just to make sure, because there's a lot of acronyms in the mental health world and in the.
It's like your resume.
Yeah, your resume.
They ask for your resume, so I sent in my resume. And I think for ASAM, that's just something where you can just send in your resume. So it's based on, like what the work you've done and kind of the service you provided, and that's basically what it is.
Okay.
Yeah.
Nice, very, very nice to know. So now that you're an elected president of the local APA, and that's the American Psychiatric Association,
Yes.
chapter for Central California Psychiatric Society, say that 5 times.
Yeah.
Can you please share with us in general what your role is like as the president of the local APA chapter?
Sure. So the APA is the American Psychiatric Association, so it's a national organization for organized psychiatry, and then each region has their own local chapter. So ours is in Central California. I think there's 5 or 6 in California. So I was elected to be president of that. So part of the role is to dialogue with the larger APA. And then our mission is just to provide quality care and to help our patients in the Central California psychiatric area. And we do put together, one of the things we do is we put together a conference, yearly conference. This year, actually, with COVID, it's been different. So we've actually changed it where we did have one virtual big conference, but this year we've been doing smaller conferences. And then we also
Via Zoom or?
Oh, okay. Via Zoom. And so that's one of the roles. Other things that we do is provide CME events where you can get CME credit. We try to advocate for our patients. So one of the organizations we're working with is called PPAC, Physicians Psychiatric Alliance of California, and we're proposing different bills for California to help our patients and mental health care. So those are kind of general things that we do when we work with there are different officers that are part of the council, and we mainly work with them as well as all the different members. We're trying to, the global role, I think, also not only helping our patients, but trying to help advocate for psychiatry too, as and to help them get the power that they need to provide good care for their patients.
Nice. Wow, that's a big role, but thank you for all the hard work.
It's been interesting with COVID.
It's
just a lot harder. Yeah, with COVID, it's been really interesting. Yeah.
Because I was gonna say the conferences and workshops are, face-to-face contact has been reduced or eliminated for quite some time. And so I imagine you guys will be having a lot of Zoom meetings or
Yes, lots of Zoom meetings.
Yes.
Now Zoom conferences too.
Zoom conferences, right.
Yeah.
All right, and so thank you for sharing that.
Yeah.
Also, you are triple board certified in general psychiatry, child and adolescent psychiatry, and addiction medicine. What motivated you to be triple board certified? Because I've mainly see people who are certified in just general psychiatry, child and adolescent psychiatry, or specialize in addiction medicine. But you have all three. So what motivated you to do all three? Because I'm thinking, wow, that's a lot of work. And I see all your certificates and all your hard work, and so
well, I think I actually knew I was going to do child when I went into psychiatry. So when I went into psychiatry, I actually applied for a program where I was going to be doing, I was going to do all of it. So some people know right off the bat, I was one of those people that already thought I knew, you never know until you do it.
Yeah.
So I actually did my internship in pediatrics. And then, the reason I picked child, because you have to do general to do child. So child is a specialization, so you have to do the general. Is because I noticed, at least in the little work I did with psychiatry as a medical student, when I talked to my patients, they all have, if you ask their life history or their story, they usually had issues when they were children or adolescents. So I felt like, well, that's, I want to be able to intervene sooner and help them sooner, so they don't have to suffer, when they're older or unnecessarily. So that's the reason I was interested in doing child and adolescent work. I'm glad I did. It's funny because I see a lot of adults, but there's a joke between child and adolescent psychiatrists. Like we say that they're either, there's like the adult psychiatrist, and then there's like the fully trained psychiatrist.
No. I see. Okay.
Just because I think that, obviously I'm biased, but I do think, having that additional training helps me be a better psychiatrist for my patients that are adults. Because, so much did happen when they're children and adolescents, and a lot of these illnesses present then, or traumas happen during that time, or invalidation. So definitely, I feel like, obviously I'm biased, but I feel like it makes me a stronger psychiatrist. And also, I think we think a little bit differently. Like, I think we think about the family more and family dynamics, or even their childhood and their upbringing. And we're used to working with different systems of care, like the school system, or as adults, maybe other systems like their work situation, etc.
Yeah, I definitely saw the difference with adult psychiatrists at the hospital at Heritage. And then huge difference in approach, perspective, diagnosis, care, treatment, language, everything, verbiage, when you're a child adolescent psychiatrist versus an adult. So I think that's what I think I was attracted to the work that you did. So because
I guess it's similar to groups.
Yes,
right?
Yes.
Yeah, is that what you're gonna say? Yeah.
I was gonna say, I think that's where
I
go, I'm definitely not a case manager. I mean, I don't mind it, but when you do group therapy, and you have people in a group to do their, just that interaction, that classroom interaction, and the things that you teach is just a different setting, just like I think working with adolescents, because I initially thought I was going to be a school counselor in high school. So I've always wanted to work with kids and adolescents.
I can totally see you doing that.
And young adults in general. So I think that when I started to work in that unit and I met you there, I was like, oh, she's like really working like the way you should be as a psychiatrist. But I go, wait, that's kind of biased, because adults usually, psychiatrists work with just adults, not usually with the families. They don't really integrate that.
That's one thing, and I think it's like myopic actually. I really don't think, I think in some ways it's simpler, right? But then you don't get the full story. And I don't think you can really intervene as strongly, and make as impactful, interventions. And I totally agree with you. That's one thing I've noticed, like they don't, not all, like some adult psychiatrists obviously do work with families, but there has to be a tendency, and they seem to really just want to work with an individual and not work with all the other factors or people involved in their lives.
I remember that, and I remember having the family meetings before discharge and things like that, and phone calls or conference calls, and having the family involved. And I was like, oh, I like that approach so much better
Mhm.
because that's who they're going home to. That's
Well,
their-
especially with these, like, you know, an inpatient, because these, you know, a lot of these patients have very severe psychiatric illnesses, like schizophrenia, schizoaffective disorder, bipolar disorder, and we actually know from the evidence that involving family will help with the prognosis. It's key, you know, so, yeah.
Totally agree.
Yeah, we were on the same way.
we were
on the
like,
same
oh, I see her, I see
Yeah.
what she's doing, I get it, I like that.
Yeah. And then for the addiction, that was like came up later. So that was like way later. So I wasn't even board certified when I was working at Heritage Oaks.
Really?
And that's why I got board certified, because I was doing that work as the head of the dual diagnosis unit, and I was like, I really don't know the subject matter as well as I feel like I should for the role that I have. So there was an opportunity, because they needed so many people to do addiction, because there was such a dearth of psychiatrists, and then, you know, we were having the opiate epidemic, that they actually made for a period of time, I don't know if that period of time is still going on now, I think it is, where if you learn the material and then you take the test, you can get board certified. So you don't have to do like, it's like self-learning, like you don't have to do an actual fellowship. So I didn't actually do a fellowship, so I just like learned the material, I took the test and became board certified for addiction. And that happened after I left Heritage Oaks.
Wow.
Yeah, so I started that practice, I started it at Heritage Oaks.
Wow.
And then, yeah, but I'm glad I did that because it definitely made me, you know, better at the work I did and I continue to do. And I think it helped with my own internal stigma too. I had probably initially with substance use and not really fully understanding substance use disorder. So yeah, so I'm thrilled that I did it. And it's pretty common to have.
Oh, no, that's my phone. Excuse me. I thought I turned it off too.
That's fine.
But, oh well.
Yeah, don't worry. But also with marijuana being legalized, it's something that you're seeing a lot of, especially in like children and adolescents. It's so sad. Yeah. It's really sad actually.
Yeah, with marijuana and vaping and you know, tobacco use, it's become a norm and a trend. And so definitely I think more so now people are beginning to need the support or therapy or care for it. Because there, of course, are side effects to all of that, and we've seen it, what marijuana can do. And not for or against it, but I've had worked with in dual diagnosis too, because that was a population that I was really scared to work with as well, or I was nervous because I was like, you know, there's so many factors to it. But I found that was one of the populations, along with the population with psychosis. You know, it worked well, and I was like, oh, that's where Dr. Ha works, and maybe so I was like, wow. So I didn't know that, but that you weren't board certified yet then, but you were working on it during that time.
Yeah, I decided to get board certified. Yeah. So
That's really cool. Thank you.
Yeah.
So now going into a little bit of your personal life. I know you're a mom of two.
Yes.
Because I follow her on Facebook. Not a stalker, I'm just following her.
We follow each other.
Yeah, we follow each other. That's right.
We follow each other.
I can only imagine what you need to do or have to do to balance your career, your community roles, teaching in universities, and just simply having fun with your kids. What do you do to have fun, and how do you relax and enjoy life?
Yeah. I mean, I think I like to have fun, so that's like one of the things that like my twin brother, he loves to have fun, and he does a very good job about making sure that he's doing fun activities all the time. So it's something that I try to do also. But the things I like to do with my kids, with COVID, we've been doing a lot more outdoor activities. So we've been going on hikes and walks. We did get like 2 paddle boards and a couple kayaks. So I know. I felt so silly. I was like, we were right here next to the Sacramento River. I never explored it until COVID. And
that's one of the beauties of COVID.
Yeah.
It's a sport you have to do the hands-on activities versus like the TV, movies, and the other things that we used to do that's not outdoorsy, you know?
Right.
So, but I do see that. A lot of people are hiking, biking, sightseeing now.
Yeah. So, and you know, we do watch TV together too. And then sometimes we read together. But those are the activities I do with my family. Things I like to do, I started growing with COVID, which is so much fun on the actual water. I like to read and hang out with friends. That's basically it. Yeah, I'm not like, I don't think I do anything too exciting. I still play a couple instruments, but they kind of went to the wayside.
What did you, I don't remember what instrument, but I know that you said you did play. What?
I played piano and the violin.
Oh,
yeah.
Wow.
Yeah. Better at the piano than the violin. Yeah.
Oh, I would love to see
But I
you play.
originally had I had some carpal tunnel from, so I haven't played recently the piano, and I switched to violin, but then
Okay.
yeah, my poor violin teacher.
Well, I hope you pick it up more, the next few months, and then if we were to have concerts or anything, we would love to have you perform or.
I'll play the piano.
Yeah, okay,
Not the
so-
violin. The
okay,
violin,
okay,
you don't
piano.
want- You do not like
Okay.
everything.
The piano then, okay?
Yeah, you sing, right?
I sing, yep.
That's amazing.
Yeah, I still sing.
That's amazing.
Yeah,
You
I
have
started
your
my-
instrument with you all
I
the time.
do,
You
but
carry
sometimes
it.
I don't take care of it, so. Yeah, sometimes I think, I don't know, I don't wanna say yell, but
Oh, yeah.
I don't rest enough on my voice.
Yeah.
But I'm a karaoke junkie, I admit, I've said it, and I have my own karaoke band. But due to COVID, we haven't really performed or hosted anything. But we're thinking once COVID gets, a little better, we're gonna go back to hosting more concerts and more events, fundraisers and stuff like that.
Nice.
Yeah, so
Nice.
you're more than welcome to perform. We're always looking for local artists and upcoming rising stars or just
Yeah.
anybody who wants to perform.
Okay, I don't think I'm that
Well, we would love for you to come by. You never know, people might want music, piano music, So, all right, well, in closing, I just wanna, ask you, Dr. Ha, that there, could be youths and viewers out there that wants to pursue and become a psychiatrist. And what are some words of advice, inspirational messages, or a message, words of encouragement that you would like to share with them today?
Sure. Well, I think one thing is, you might have challenges, going forward. I know you have in your career, and I definitely have in my career, especially if you're, any kind of minority, so if you are a woman, or if you're a person of color, or different, not heterosexual, or what have you, or, if you fit more than one of those boxes, it might be even more challenging. So I think the biggest thing is to not let other people try to define you or hold you back, and to kind of persevere and believe in yourself and keep working hard. So I think that's the thing, and to a certain extent, I think to expect it too, because I think it's going to happen. Maybe not when you're in schooling, but definitely when you're out in the workforce. Because that's just the power structure of our society, right? And so to expect it, to not be afraid to, call it out when necessary, and to ask other people for help too. I think another thing, because I think, what you're experiencing is probably not unique. It's probably happened to other people, and so you can kind of, dialogue with other people, get advice on how to handle some sticky or thorny situations, because you probably will be treated differently, and it will be more challenging, or even economic struggles, right? That could be another thing. So, but I think going with your gut too, because for me, psychiatry wasn't something that I felt a little bit, worried about going into it because of the stigma of mental illness, but then I loved it. So not being afraid to do something, even if it isn't something that maybe society deems as being really, I don't know, that they don't value per se. So I think, and especially if you specifically want to go to psychiatry, you're gonna have to deal with that a little bit, just because it's still, stigmatized. Mental illness is still stigmatized, and so we are still stigmatized by proxy. So, and get ready for all the bad jokes you'll hear.
Yeah, I was gonna
When
say.
they say you're a psychiatrist, just get prepared. Yeah, but I love it. I think it's a great job. It's a great fit for me. I feel so lucky, and I really like working with my patients. They're amazing, and you'll learn a lot from them too.
Yes.
For sure.
Well, that's great to know. I'm so glad that you're able to share your inspirational and encouraging words today, because I definitely saw it when I was at the hospital, is all the clients or patients and their families sharing how, just how happy they were to have a good psychiatrist that cared about them. So I just want to let you know that, after all these years, I still remember the feedbacks and the comments and stuff. So, and I'm sorry if I didn't tell you all that then, but I remember, just I think like how you remember what they would say about my group therapy work.
Yes.
I would remember what they would, they would share about their interactions with you and how much you care and how sincere you are and how genuine you are. So I really truly feel like your heart is in this, and so I want to really thank you for taking the time from your busy schedule on your Saturday to talk about your life in a nutshell, and for the Project We Inspire platform and YouTube channel. I think if having you here, being an Asian woman and being here in Davis in the Central Valley, I hope that it will inspire and help other youths and young adults to know that it's okay to be in this field, that you're gonna face all these challenges. Yeah, we need it.
People.
We absolutely need it.
Totally. And then young people are the ones who are gonna change it too.
Yes.
They're like so much more open about these illnesses, and
So I really do see that you're a leader in this community, in this field, and I definitely look up to you. And so I really do hope everybody that watches this can learn a lot today, because I know we touched on a lot of different things. If you guys have any questions, feel free to message me or go to Synapse Association for services if you should need anything. If you guys should need any help or assistance, please, call 911, go to your local practitioner, primary care provider, if you guys have any questions about depression or anything like that. So have a great weekend, have a wonderful Saturday, and we'll see you guys again. All right, thanks, bye.